The History of Whooping Cough by Chris Levesque. In 1578, Guillaume de Bellot was credited with the first description of whooping cough. He was a French physician who was a native of Paris. He studied the epidemics that plagued Paris and came across a cough or illness that was spreading rapidly. He described what the symptoms of the cough were and the age of people that the illness most commonly infected. In France in the year of 1906, Jules Bordet, along with his assistant, Octave Ginju, discovered the microbe that causes whooping cough. They isolated the bacterium and named it Bordetella pertussis. He concluded that these bacteria produce toxins that paralyze parts of respiratory cells, leading to inflammation in the respiratory tract. Bordet is considered the father of Belgian microbiology. In 1940, Dr. Pearl Kendrick and Dr. Grace Eldering developed the first successful whooping cough vaccine. This vaccine decreased the amount of babies and children that contracted whooping cough. Now, death caused by whooping cough rarely occurred at all. However, in 2010, a pertussis epidemic was declared in the state of California with about 9,143 cases and 15 infant deaths. Overall, in 2010, about 27,550 cases occurred in the United States, and many more cases went unreported. The scary question is, where and when will whooping cough strike next?